I'm a naturopathic doctor. I graduated from the Canadian College of Naturopathic Medicine, which at the time was the only accredited school in Canada for naturopathic medicine. I practiced in a number of multidisciplinary clinics, including one with a medical doctor, working alongside medical doctors and allied health professionals, and realized that there were some holes in our industry in terms of treatment and providing people with holistic treatment. So then went on to open my own wellness center along with my husband, where we feel like we've addressed what we felt was missing in a holistic approach to healthcare. I see all the clients at Turning Point for an initial, where we do a conventional medical screening. They also see a conventional medical doctor that does all of their lab tests and blood work to make sure that they're able to tolerate the program. I follow all of the clients through the program and make sure that they're tolerating the protocol okay, and make sure that we're individualizing the program to meet their physical needs. So the sort of widely accepted view of orthomolecular medicine is simply that it uses dosages of vitamins and minerals that are several times higher than the recommended daily intakes, or megadoses of vitamins and minerals. But what's also not usually understood about orthomolecular medicine is it incorporates an individualized approach. So we look at people as having individualized biochemistry, given their family history, genetic makeup, as well as their personal medical history, their current medical health and any disease processes, as well as their substance of choice that they're abusing, their diet, the way they're eating, supplements that they're taking, and truly individualize the approach to best suit their personal biochemistry. I think that's multifactorial, and I think that the approach with Turning Point addresses people both on the physical level as well as a spiritual and emotional level. So the counseling that the guys receive is by far and away probably the best that I've ever seen, and the amount of support they get, and not in just their counseling sessions, but in the whole approach that is provided and created around them while they're at the program. It's a family-oriented program. It's group living, it's group eating, it's group healing. So all of the people they come into contact with, not just their counselors, but sauna staff and resident staff, it really becomes like a family. So they feel that they are supported in a way that they perhaps may not have been before. And then we look at vitamins and minerals and the biological approach to what their body needs in order to undergo a detox process, which is inherently a very nutrient-dependent process, very stressful on the body, and requires a lot of support, a lot of physical support for them to be able to tolerate and make it through to the end of the program. The vitamin and mineral therapy, I think, is really important because detoxification requires so many specific nutrients, particularly for your liver, your kidneys, your heart, your lungs. And in order for all of those organs to function properly and take you through that detox process from beginning to end, you have to have all of those key ingredients, all of those vitamins and minerals that your body is literally using as ingredients to perform those functions. If you don't have those detox processes get halted. And the problem with that metabolism halting partially through that process is they often become more damaging. Those intermediate metabolites become more damaging. They act as more significant free radicals and cause more damage than if they had have just been stored and left alone safely in fat tissue. I think probably the most apparent, particularly for the clients who are using the niacin, is sort of the niacin flush that everyone hears about. And we do use that intentionally and therapeutically, and the purpose behind a niacin flush is to cause vasodilation, or the dilation of your smaller blood vessels. So the purpose of that is to get increased circulation to your organs, which carries with it more nutrients, as well as carries away from your organs more metabolic waste. So with the increases in circulation, we see much more rapid detoxification. And then outside of that, which probably most of the clients are unaware of what that niacin is doing, is niacin is a precursor for something called NAD in the body. And that's the primary metabolite that creates cellular metabolism. So it creates, all of your cells are allowed then to function, to create cellular energy and metabolize cellular waste. So that's another really important aspect of the niacin, as well as DNA repair. Niacin is directly involved with hormone synthesis, particularly steroid hormones within the adrenal glands, as well as being a key ingredient in the metabolism of tryptophan to serotonin, which we often see symptoms of altered levels of serotonin, particularly during withdrawal. So the benefits of B12 could be pages and pages long. For us specifically, the reasons we use B12 and we use B12 injections rather than supplements is primarily for the health of brain tissue and the nervous system overall, including nerve health. It helps to make and regulate healthy red blood cells, and it's also used with DNA repair. So we use a specific form of B12. It's called methylcobalamin. The more commonly used and easier to find form of B12 is cyanocobalamin. It's a completely synthetic form of B12, much less expensive, so that's why it's usually the one that's found in things like supplements and in conventional therapies. Being that that's completely synthetic, the body has to do extra work to turn that into methylcobalamin. Methylcobalamin is a naturally occurring B12 that we find in our food, particularly in animal products. So we use that form directly through injections. Your only other alternative with B12 through food is a form called hydroxycobalamin, which is created by bacteria. But we use the methyl also, not only just because it's a naturally occurring form of B12, but that methyl compound that it's bound to supports the liver's detoxification process, specifically phase 2 liver detox, which is the one that we really need to make sure is functioning well to avoid the buildup of sort of a backlog of toxic metabolites moving through the system. So this is directly related to the liver, which we target a lot during detoxification, along with other organs, but the liver is really the organ that processes almost everything that goes through our blood. So when we're exposed to any toxic metabolite, whether that's a drug metabolite, prescription or otherwise, food metabolites, environmental toxicity, whatever that toxin is, it can do one of two things. It can go through your liver and be metabolized and excreted, or if your liver is unable to deal with that, it'll be stored in fat cells. And once it's stored in fat cells, it's safe and it's cornered away in the body, and it really causes very little problem until your liver is able to deal with it and then breaks it down, and now that toxin becomes active in your circulation again. So we want to make sure that we're eliminating as much of the toxic residues that we can, and once they go through the liver, they first go through a phase called phase 1, which makes toxic metabolites slightly more water soluble, but more reactive. So when we think about free radicals, for example, they become free radicals in the body. So often those free radicals are more damaging to tissue than the original toxin. So then we have to make sure that phase 2 is then moving that intermediate through the rest of metabolism to make it entirely water soluble so that it can be excreted either through your bile and through your stool or through your kidneys and your urine. So, and that also is highly dependent on individual physiology and what someone's body is able to tolerate. So if their liver is at a point where it can no longer metabolize those toxins, it will be stored. It will be stored in fat cells. And that's the concern with relapse, because people will often go through a detox program and be clean for a number of weeks, months, years, maybe even. But as their liver heals and those toxins are released back into their bloodstream, that can sort of set the stage for relapse. So if you sort of have all of those things coming into place at the same time, you increase your risk of relapse from those metabolites being circulated in your blood again. Perhaps an emotional stress or a family stress or a physical stress, if all of those things add up, that can significantly increase to relapse. Can also significantly increase to future risks of health disease, including things like heart disease, high blood pressure, cancers. So it's a concern, and that's part of the goal, is to rid the system entirely, rid it of as much as of those toxic metabolites as we can. And I think that largely comes from cleaning out those fat cells and cleaning out the system so that it decreases the risk of relapse as they move back through. And outside of the active role of detoxification, I find the clients, when they're exposed to healthy living and they're exposed to exercise on a regular basis and they're exposed to some mental emotional support, that in itself decreases their risk of future health diseases, because they're eating cleaner and they're living cleaner and they're exercising, and they're dealing with stressors in a more healthy way. Well, yeah, because it's not necessarily just drug and alcohol metabolites that are stored and can cause problems. Food metabolites and all the artificial foods that we consume and the chemical-based foods, environmental pollution, it's a means of just cleaning the system as a whole. And metabolism naturally creates harmful waste products. And that's the role of the liver and the kidneys and the lungs, is to get rid of them. That's why we have them. They're naturally occurring. So being able to clean your system out, it can help with many, many health-related concerns, and it can help to prevent them. So even people who are healthy and just want to stay healthy can benefit from that kind of process. Absolutely, and I do think it's important to mention that we don't encourage the clients when they leave to continue with the dosages of the vitamins and minerals that they're getting at Turning Point, because they're monitored at Turning Point, and they are orthomolecular dosages, so they're not sort of the dosages we recommend for long-term health maintenance. But certainly once to twice a year, I think people can benefit from a detox program and cleaning out their system and just, getting back on track and not slipping into old habits and not slipping into old loopholes where that you may stumble. I remember when I was first approached by Turning Point and hearing the stats that Turning Point had, and I thought to myself, I have to see this for myself. So when I became involved, I was amazed at how quickly that transformation happened. The guys would come in, and although all the clients are medically stable and not in active withdrawal, they would come in and be one person. And within days, literally within days, they were thinking clearer, they were speaking clearer. They had that light back in their eyes. They would tell me, I feel like myself again. I haven't felt this good in years or however long. So yeah, I think that it's remarkable how quickly that turnaround can happen. And I think it's remarkable the body's ability to heal itself if you feed it what it needs. And I don't just mean, in terms of food. I mean, if you feed it the nutrients that it needs, if you feed it the emotional support that it needs, and if you feed it the spiritual support that it needs.